So our patient JC, she's gonna be our model tonight, and she hasn't had any jawline filler in the past, right? What we are trying to achieve with her, she has a very good profile. So her chin and her nose are well balanced. So we're not gonna add a lot of chin projection. We will add a little bit on the pre-jaw area where she's missing a little bit of this volume, and obviously on the gonial angle, right? What we want to do is just kind of like make her jawline a little bit sharper. And what I was explaining to her a minute ago is that just like when we add lateral volume to the cheeks, the face lifts this way, right? The same thing happens when we add a little bit of volume on the jawline. It just pulls back a little bit. So that's what we are trying to achieve. And we're going to add a little bit of product on the gonial angle, right? And then a little bit of product on the pre-jaw area, avoiding always the little area where they already have a little bit of volume, like the jaw area. I tell my patients we are trying to create kind of like this visual or illusion, right? That the jawline is a little bit straighter and sharper. We are going to do some injections with a needle, okay, on the gonial angle. I've seen some injectors doing some needle injections on the ascending ramus as well. I like to do that area with a cannula. So the only needle injections that I do is gonial angle. And obviously, if I'm trying to project the chin this way, I will do a needle too. But we're not going to do it on her. She doesn't need it. And then everything else is with a cannula. We are going to use Restylane Lift for the jawline, for the gonial angle, and then Restylane Define for the pre-jaw area. The other products that I normally use in the office is Volux on the jawline, that works beautiful, and then Voluma for the pre-jaw area, and they work really well too. I use a lot of Define on the chin, so I know she's gonna have great results, and she has a good bone structure. If you guys watched the video that we did a week ago with the didactic of the jawline, what I was trying to explain is that whenever you have a patient asking you for jawline, the first thing that I do is palpate. So if I feel like my fingers are having to go super, super deep in their tissue to be able to palpate the bone, sometimes those are not good patients for jawline because they're gonna end up needing so much product, and you run the risk of whenever they open their mouth wide, you're going to be able to see that bulk of that product there, and you're making their face wider. So it's just not the best idea. So you want a patient like JC, right, that as soon as you palpate their jawline, you can feel the bone right there and then, because you have a good layer, like place to layer that product. So, and she's a great candidate. She's going to love it. Okay, and we're not going to add a lot. I'm thinking maybe one lift on each side, which is very conservative. Remember, it's just 1/5 of a teaspoon. And then I'm planning on using just 1/2 of a Define on each jowl. So just 1/10 of a teaspoon. So it's going to be subtle, but definitely something that you will notice. You're going to love it. Obviously the facial artery, right, that you can palpate. If you run your finger along the jawline, you're going to feel like a notch. And if you cannot find a notch, which will be rare because everybody has that big notch right there, you can also have the patient clench. So you can palpate for the masseter, and the facial notch, the facial artery and the gonial notch is going to be right there in front of the masseter. So that's something that I always mark with a pencil just to be aware. I never do needle so close to that area because obviously for safety. So you are with a cannula, which is safer, and you're superficially enough that you shouldn't be close to the facial artery. But just always be aware that it's there. So I always mark a little X right there where I feel that notch where the artery is. The retromandibular vein, that it just kind of like almost lays really, really close to that ascending ramus, and is really, really big. It was like almost the size of a pinky. So you have to be careful with that one, and that's why I try to avoid that needle injection on the ascending ramus. I like to do the cannula better. The parotid, remember, it's kind of like big, you are again with a cannula, so you should be safer. But if the patient complains about pain, that may be one indicator that you are in parotid. Or if you feel the tissue kind of like spongy with your cannula, that may be another indicator too, and you just need to stay away from it. The facial artery has another branch, right, that comes right here, then kind of like transforms into the angular artery right here across the nose, and then the transverse artery, which we're not going to be even close right now, but just so you know. And then whenever we're doing chin, the sublingual artery, right, that it's supposed to run 6 millimeters apart on each side, obviously, 6 millimeters away from the midline. So just be aware of that. And that especially is if we're using a needle, right? For the chin, we're not going to use the needle tonight. If I add a little bit of chin, it's going to be kind of like with the cannula, and it's going to be more kind of like on the pre-jaw area. So when I treat my jaw lines, I always like to mark, kind of like do a little map of my treatment. I mark the ascending ramus, right? Remember, for a female, it's going to be more like a hockey stick, right? We were talking about that 120 degree angle, 120 to 130 for a female, when for a male, you want the 120, which is more like an L or straight. I always mark that little hockey stick, which is what we are trying to create, that gonial angle, right, where we're going to do those injections, those first injections. I always mark where they have their natural jowl. So if you push with your finger right there, you're going to be able to see where she's bulging. So I always mark that as a no-go zone, right? I don't want to add anything right here. Ask the patient to kind of like pucker, and they're going to show you their muscle in the chin, their mentalis muscle, and I kind of like mark that too. And I mark my midline. Remember that chin is supposed to be aligned with inner canthus, ala of the nose, and then the chin. So if we wanted to project her, obviously because she's a female, right, and we want to have that little projection and elongation more feminine, we will concentrate on the medial section of the chin. When if a male, right, you go a little bit more lateral into the oral commissures. But for her, again, her profile is so good when you see her laterally, right, that we're not going to add any projection on the chin. That's perfect for her. So we're going to add a little bit of product right here, and then we're going to add product right here with a cannula, and then with the needle on the gonial angle. Again, our jowl, right, the no-go zone where we don't want to add any volume. And then I mark the notch over here, or the artery, right? Let me mark it over here too. And remember, the artery normally is going to be nice and deep, so you shouldn't be too close to it. But I really want to be aware of exactly where that notch is, because I'm going to be doing those deep injections with the needle right there, so just you don't want to be too close to that. It's a product that it's approved for cheeks, right? It should give us enough projection for the jawline. And we're going to be using a 25 gauge, 1.5 cannula. I'm using the 27 gauge first, right? The needle that comes with lift, because we're gonna do those deep injections first. Then we're changing to our cannula, and it's a 25, 1.5. Aspirating, right? Nice and slow. And I'm planning on adding maybe a 1.5 or even a 0.2 bolus, because we really want to create that little lift right there. That is one of the things that really kind of like frames the jawline. Let me know if something bothers you, Jason. You can see a little bit of the volume right away, which is really nice. Very good. Ooh, you're gonna like that. Okay, I did a 0.2 You guys can see a little bit of that volume already. I did one right on the angle, right? And when you're injecting a female, right, because you don't want to make their face wider, I inject more in this angle. When I'm injecting a male, I'm injecting more in a 90-degree angle like this. And when I'm injecting a female, I go more kind of like in a 45 angle, because you want to give them, you almost want to elongate that bone, right? That rim of the bone to pull the skin without giving a lot of like volume in that area or widening their faces. And I, just like when I do my cheeks, I pull back the skin on the jawline as well. So I pull a little bit of the skin and then I go in. Little poke. Aspirating nice and slow. And I'm gonna do maybe like a 1 or a 0.1 or a 0.15 on this one. And I'm always kind of like watching, right? Observing the volume that I'm creating. And that really and this is like the artistic part of this, right? So it's hard for me to tell you, oh, it's gonna be a 0.2 or a 0.1 because it's gonna vary on each patient. That looks beautiful. So we did a point, I'm very close to the 0.6. So a 0.15. I'm gonna change it to the cannula and then we're gonna do a little straight line. I don't know if you guys can see that now. You can see a little bit of that volume right there that we are creating. Now we're gonna do a little line right here and a little line right there. And then we're gonna target the pre-jowl area with a little bit of define. So now we're gonna transfer to the cannula. And the cannula, remember, it's supposed to be dermis, right? So even if you're using a thicker product, even with Bullocks, that it's super, super robust, you still wanna be in dermis. So don't go too deep. The deeper you are, the closer you are to those big ugly vessels that we're trying to avoid. So stay superficial, just inform the patient, right, that they're gonna be able to feel the product for the first couple of weeks. That's super normal, especially with Bullocks. Bullocks, they're gonna feel the product for 3 or 4 weeks. With Voluma or Lift, they're gonna feel it for maybe 2 weeks. I'm gonna do a little poke, okay, a little cannula entry point. I'm gonna do it right here, poke, poke. And when you introduce the cannula entry point, you don't have to introduce a lot of the needle. I feel like that's one of the reasons why I see, like whenever I do trainings, they go in with the needle so much and you really don't need to. Remember, you're just giving a little entry point to that cannula. I do twist a little bit the needle, but you really don't need to go too deep with the needle. I feel that obviously is going to give you better chances for bruising the patient. And remember, with the cannula, right, we're in dermis, so you're supposed to see the shape of the cannula. I don't know if you can see that. The shape of the cannula, right? But not the color, obviously. So just like with a needle injection, dermis is shape but not color. And you can always check your depth placement by pulling a little bit your cannula or your needle. Okay, so I'm gonna do a little line right there. And you could add more in the gonial angle if you wanted to. If she needed a little bit more, we could. But I'm just gonna do a little line. Go back. Let me know if you need a break. And the line that I'm doing, it's maybe like a 1 or a 0.1 on each little line or 0.15. So we're creating that little jawline. So now I'm going to do a little bit of these ascending ramas with a cannula as well. So I'm going to do another little entry point right here, and then we're going to create a little bit of and it's really kind of like almost behind the ascending ramas, because again, you don't want to widen their face, right? You want to pull back, just like kind of like creating this kind of motion by adding a little bit of product right there in the back. And I have a 0.3 to play with that for the ascending ramas, because I went in from where you're numb already. She gave me a little drop of blood, so I'm just going to put a little bit of pressure right there. When I get a little drop of blood, it doesn't matter if it takes me an extra minute in my treatment. I always like to put pressure right away. I feel that's the best way that you can avoid the bruise from getting bigger, more than the arnica, more than the ice pack. I think just take a minute out of your busy schedule and put pressure. And sometimes I tell my patients, oh, you're going to bruise there. And then they come back and they're like, oh, I never bruised. And I don't know if you see it, but when I'm kind of like gliding the cannula in, I hold the cannula almost like a pencil. To have better control. And then as I move, sometimes I do the same. And then once I'm going to press on the plunger, then I change my hand into the other position. I think that's easier. Same thing, dermis, right? You can see the depth of the cannula right there. That's where you want to be. And if you see, I'm kind of like almost behind her jawline on the ascending ramus, just to kind of like pull back this way the tissue. So I have a tiny little bit left. I feel like she still needs a little bit right here, right on top of that the notch, right? We tend to need a little bit more product. So I'm not going to waste anything. I was raised not to waste anything. And this is like liquid gold, so we're not going to waste anything. I'm going to go back again in that little port that we created right here, and I'm going to deliver just the tiniest line right here. I have like a 0.05. You see, I'm holding the cannula almost like a pencil until I go in. And once I am where I want to be, then I change. Remember, this product, JC, is the product that is approved for cheeks. So it's a thicker product, right? Remember, whenever we do cheeks, jawlines, chins, we're kind of like mimicking bone, and that's why we choose these products. So you're going to be able to feel it for a good 10 days to 2 weeks, okay? Whenever you wash your face, whenever you put your makeup, your products, you're going to feel the trail of product that I left there, and you're going to feel like a bump right here, the ones that I did with the needle, okay? Super normal. Don't massage it, don't mold it, don't press on it, don't do anything to it, okay? Just let it settle. The product by itself is going to integrate into the tissue, and then you're not going to feel where it is. Okay. I added a little bit on the gonial angle with the needle, and then a little bit on the actually ascending ramus and the jawline with the cannula. Nothing on the jowl, right? Because we don't want to obviously volumize or create more volume right there. And now we're going to do the same with the define. We're going to work on the pre-jowl area so we can have like a more even kind of like sharp jawline. So you're doing great. And I think with one entry point, we're going to be able to cover the whole area. That's why I like the 1.5 inch cannula, because you can work in a larger area with just one poke. Same thing, okay? We're gonna create the little entry point for the cannula, so you're gonna feel a little poke. Okay. This is the only one that you're gonna feel. And I'm gonna create the entry point almost on the jowl, okay? Just remember that obviously you don't wanna add anything right there. And then we're gonna go this way and cover all this little area. Maybe like a quarter of the needle in, okay? And then a couple of little twists. Good. And then I like to pinch a little bit until I see like the tiniest drop of blood right there. So you don't lose your entry point while you turn and you grab the cannula. You can pull a little bit on the skin as well. That helps you to kind of like glide the cannula. And always remember the direction of your entry needle, because I think that's the key of being able to glide your cannula easily. If you just remember exactly where you were pointing whenever you were doing your little entry point and just follow that path for your cannula. And remember, when you're using your cannula, be very careful not to touch the cannula with the skin, okay, when you're gliding in. So we're going to deliver a little bit of product right here. We're going to do a little line, and we're planning to use half of the syringe on this pre-jowl and then half on the other side. So we're going to be careful with, and obviously Restylane Define is a lot softer, right? So you can be even more superficial. I like Define for this area because it integrates so well into the tissue. So it's a great product for this area. Like I said, I use a lot of Define for chins and pre-jowls. So I am all the way over here, okay, with the cannula. We're gonna deliver a little line. And it's like super thin little lines, right? We don't wanna deliver a lot of product there and then make the patient feel or look bumpy or bulky. So tiny, thin little struts. Even if you have to come back, sorry, Stacey, I know we have a ligament right there. I had to cross. Now you're a little bit numb, so you're not gonna feel much. I'm gonna go back right here. So we are creating the illusion, right, of like hiding the jowl because we're adding a little bit of product on the front and a little bit of product on the back. I like how that looks. I feel like she still needs a tiny little bit right here. So let's add a tiny little line right there, and then we'll save the rest of the product for the other side. And I see some injectors adding like 3-4 syringes in between the chin and the pre-jowl area. I think that volumizes the chin so much that it kind of like changed the shape of the natural shape of the patient's face. So I'm not kind of like, I don't like that technique. I think more natural, subtle. And for a female, that's normally what I would use. I use either Bullocks, Voluma, or Lift, whatever I'm using, one syringe on each side. And then sometimes, depending on what I'm using, I will use 1 and 1, right? And depending on obviously on how much volume depletion the patient has in the pre-jowl area, or I use half and half, just like we're doing today. So I don't know if you see, but I'm pulling the skin, right, with my thumb, making sure that I'm right on the angle where I want to be, and then kind of like with a 45-degree angle, I go in, touching bone, perfect right there. Aspirate, nice and slow. And on the other side, we did 3.5 or 0.35. So we're planning on doing kind of like the same, but obviously just be looking at it, right? If you feel like she has good correction with less than that, stop right there. Remember, this is an art. It's not going to be perfectly symmetrical on both sides. Same thing if she needs a little bit more, just do a little bit more. I explain to my patients, it's almost like if you pull curtain and you tack it with a needle, with a nail on the wall, for example, it just stays there because you're putting a little bit of product but pulling the skin before. I really like that technique. And remember that when you go in with the cannula, you can always add a little bit more on the gonial angle if you feel like you need a little bit more. But I do like to give that projection with the needle first because we know that laying the product on bone is whatever is going to give you the most lift, the most projection. That looks beautiful. Love it. So right where you draw the gonial angle, and you can palpate, right? That's the gonial angle right there. So this is the ascending ramus right here, and this is the lower border of the jawline. So right there in the corner, that's where you're trying to create the little lift. And then you go in and fill out with a cannula just a little bit on the ascending ramus and then a little bit on the jawline. But it's right on the angle. Right where they meet. So we're going to create that little entry point again. And the other thing that I do sometimes is the patient is more mature and they have a little bit too much of the pre-jowl or the jowling, right? If they have like a bigger kind of like, you're not bad, JC. So, but if the patient comes in with like a fuller jowl, sometimes you can start working. Before you treat the jawline, I will work with Kybella off-label in that area to try and minimize a little bit of that fullness of that jowl. And then after we see the results of Kybella, jump to doing the jawline, because like reducing that fullness right there, it's always going to help to give you a better definition on the jawline. Some patients are even just happy with the Kybella result, and then they're like, I don't think I need the jawline anymore, and that's fine. Remember, whatever makes the patient happy. Movement, okay? A little bit of movement. And again, holding my needle or my syringe like a pencil first, okay, to give you more control. And you want to be superficial, remember, dermis, right? You want to be able to see the shape of your cannula right there. I don't know if you can see that. Mm-hmm. Okay. Turn, turn, turn. And we're going to do little lines. And I'm kind of like watching my amounts, right? I know that on the other side, I did like a 0.3 on the ascending ramus. So I'm trying to kind of like deliver even amounts of product. So just be aware of that when you're doing your treatment. That looks beautiful. And remember, it's going to look sharper in the beginning, right? So for the first couple of weeks, 10 days to 2 weeks, remember, the patient is going to be able to feel the product, right? But it might be even able to even see it a little bit, okay? For the first couple of weeks, it's just swelling. Don't worry about it. It's going to fade, okay? It's going to integrate, and then you're not going to be able to see it. Sometimes we wish it could stay like that, but it just fades. It integrates into the tissue, and it's a lot softer. Okay, very good. So I'm going to do another little entry point, okay? That looks awesome. I'm going to do, and I'm going to massage right now. I'm going to do another little entry point, and we're going to create a little bit of that ascending ramus right now. So same thing, I saved the same amount, okay, a 0.3 for that ascending ramus. And remember, if she was a male, right, I would be working with the projection of the jawline in a more angular way. So I will do a straight line right here. But because she's a female and we want to create a little hockey stick, right, I'm doing the ascending ramus a little bit more kind of like in an angle instead of completely straight like if it was a male. That's super important. I feel like I've seen some injectors injecting females with that super sharp line right there, and that is more manly. It's not supposed to be like that on a female. And try to stay superficial right here, right? Because you know that right there is the parotid gland, that it's very superficial right there. I don't know if you can see that kind of like this side looks nice and straight now, right? Because we added a little bit of product, but this one, you can see kind of like a little indentation right there. You can still see the jowl, and you can see kind of like volume loss right here. So the plan is to add a little bit of product right there, right? And then a little bit of product right here, right here, right here, right here, just to blend that jowl and kind of like hide it. So it's just everything. It's like a visual illusion what we're doing. We're trying to trick the eye. So I'm going to do the little entry point, and I'm actually going in the jowling area, right? Just remember that don't push product in the jowl. Just push the product where she needs it. Dermis, okay, you want to be superficial. You want to be able to see the shape of your cannula. And if you're having issues gliding your cannula, I feel the best way and the easiest way for the patient as well is to go like little tiny motions, like short little motions back and forth. That tends to help for the cannula to glide in a little bit easier. Don't try to put too much pressure in one single area. I feel that it's painful for the patient. And you can, like, if you're trying to go through ligament or just like layers of tissue and you go too fast, right, you can always go too much in, and you can injure the patient. So nice and slow, little motions back and forth until you are where you want to be. Okay, my cannula is right here. So we created a little line right here, now a little line right there. And thin little lines, we can always come back and do a little bit more. This is the one. Sorry. Beautiful right there, okay? After we do that first little line, because you have already a little bit of the numbing, then you don't feel it much. Perfect. And right here with the cannula. So straight line right there. So this pre-jowl area helps with obviously hiding the jowl, right? But it also helps with chin. It helps with marionette. If the patient has and we already work with JC with her oral commissure, so she's great. But if a patient has the oral commissure a little bit turned down, you can go all the way straight to the oral commissure and deliver a little line of product right there. And that helps to give them a little bit of support. And it just softens everything. And then at the end, I just massage everything, right? Remember the product that we use right here, Restylane Define, it's kind of it's like an intermediate kind of filler, right? Because it gives you enough support, but it's still soft. And what I like is that it has that, it's stretchy, so it kind of moves with the mouth whenever the patients are talking or smiling. So it is a great option for areas around the mouth. So let's mold a little bit, and that's it. Very good. And I like to massage with bacitracin. I tell my patients, or I explain to my patients, right, the entry points for the cannula is a little bit bigger than the needle, okay? So those are gonna be open for a little bit longer, okay? So we have to be extra careful with those little entry points.
Not that bad.
Not too bad. A lot of patients tell me that this one is easier. I feel like the cannula makes the treatment just easier for the patients, especially for patients like JC, right? She's not scared of the procedure, right? There are patients that are super nervous, and they're everything they feel, they kind of jump, right? Those are the patients that I think it's a little bit harder for them with a cannula because you feel more, right? But it's less pokes. I feel like it's just so much easier for you, it's safer for us. So I just try to explain to my patients, because the cannula is blunt, right? If we touch a vessel, instead of breaking it and causing you to bleed and bruise, it's just going to push that vessel around. So it's safer for you and me. So, and it's the best way to deliver the product in the right plane, I feel, in that area. And safely, of course. If she wanted a super, super sharper jawline, more than what she got, maybe Bullocks, right? Because it's thicker and in consistency. But I think these products work really, really well. I use Lift and Define a lot. And remember, when we treat the jawline, right, because we're kind of making everything smoother and straighter, look how her jowl, it's almost gone now, because now it's hidden, right? And automatically helps with this area as well. The submentum area gets better. So hopefully in the pictures we can capture it so you can compare. But automatically we get improvement on the submentum, and then obviously the jowl is hidden. Looks really good. Really, really good. Yay!